You know, a hot pan, a splash of boiling water, 1 second of distraction, and bam, burns happen in an instant. But when they do you really know what to do? A lot of people think they do, but that first instinct is often not just wrong, it can be downright dangerous.
So let's just picture it. A busy kitchen, you turn your back for a second and a child's hand touches a hot stove. You hear that scream. Your gut tells you to do something, anything, to make the pain stop, right? Well, that split-second decision you make is absolutely critical.
So I'm asking you, what's your first move? What do you reach for? Ice? Butter? Maybe that old trick with the toothpaste? Take a second, and I mean really think about it. Because what you do in those first few minutes can be the difference between a fast recovery and a lifelong scar.
Okay, whatever you just thought of, just hit pause. Because a lot of those go-to remedies, the stuff we've all heard about or seen in movies, can actually make the injury much, much worse. Let's dive into why that is.
First off, what even is a burn? Well, it's not just a red mark. That heat is literally cooking the tissue, and the damage can go way down, deep through the layers of your skin. The entire goal of first aid is to stop that cooking process before it gets any worse.
And that brings us to all the myths. You know, the things people do with the best intentions that just end up causing more harm than good. So let's start debunking some of the most dangerous ones right now.
Let's start with toothpaste. I kind of get it. It feels minty and cool, so the logic seems to be there, right? But in reality, it's a terrible idea. Toothpaste is not sterile, and it acts like a blanket, trapping all that heat inside the wound. That lets the burn get deeper, and even worse, it can introduce bacteria, which is a perfect recipe for a nasty infection.
Okay, so what about ice? This has to be the right answer, doesn't it? Fight heat with extreme cold. It feels like the most logical thing in the world. It's an incredibly common reflex, but it's a huge mistake.
So here's why ice is such a bad move. It's just too aggressive. That extreme cold causes your blood vessels to clamp shut, which cuts off blood flow to the skin that's already injured. That tissue is desperate for oxygen, and now it's being starved. So the damage actually gets deeper. You're basically creating a frostbite injury right on top of a burn.
And the list of bad ideas just keeps going. Butter and oil, they do the same thing as toothpaste. They trap heat. Things like mud or herbs might be traditional in some places, but they are not sterile, and you are asking for a serious infection. And raw cotton, it just shreds and sticks to the wound, which is super painful to remove and becomes a breeding ground for bacteria.
All right, that's enough of what not to do. Let's flip this around and talk about what actually works, what's based on solid evidence, and what global health experts recommend. It's way simpler than you'd think, and it all comes down to one key rule.
The single most effective thing you can do for a heat burn is this: cool it down. It's that simple. But how you cool it, well, that's everything.
The correct move is to get the burn under cool, clean, running water right away. And let me just stress this: cool, not ice-cold water. This simple step does two critical things at once. It physically stops the heat from doing more damage, and it gives you some immediate pain relief.
And now for the most important detail in this entire explainer: the duration. You have to keep the burn under that cool running water for a full 20 minutes. Not 5 minutes, 20. I know, it's going to feel like a long time, but all the research shows this is the critical window you need to pull the heat out from those deeper tissues. This is what helps prevent severe scarring.
So, what do you do after those crucial 20 minutes are up? Well, the next phase is all about protecting the skin and knowing when it's time to get a professional to look at it.
So once it's cooled, you gotta think about swelling, because it's going to happen. Before it starts, gently take off any rings, watches, or tight clothing from around the burned area. Then, you want to cover the burn loosely. The key here is using something clean that won't stick. A sterile dressing is great, but even plastic cling wrap works really well in a pinch.
So why cover it? Because a burn is an open wound, and that's like an open door for infection. Covering it keeps it clean. It also does something else pretty cool. It helps reduce the pain because it protects all those exposed nerve endings from the air.
Now, of course, some burns definitely need a doctor. So use this as your checklist. If the burn is bigger than the person's palm, go. If it's on a sensitive area like the face, hands, or joints, go. If the skin looks deep, waxy, or charred, don't even hesitate. And you should always get help for electrical or chemical burns and for any serious burn on a child or an older person. And hey, a really quick but important note on chemical burns. The first thing you do is safely get any clothing with a chemical on it off the person. Then, just like a heat burn, you rinse the area with tons and tons of cool water, often for even longer than 20 minutes, to wash that chemical away.
You know, the best way to treat a burn is to prevent it from ever happening in the first place. And the World Health Organization is really clear about this. Most burns are preventable, and they usually happen right where we feel safest, in our homes and at work.
And the stakes here are unbelievably high. According to the WHO, burns cause an estimated 180,000 deaths every single year. The vast majority of those are in low and middle-income countries. This isn't just a minor accident. We're talking about a global public health crisis.
The good news is that prevention is usually about simple habits. I mean, think about cook stoves. An unsafe, unstable one is basically like putting a giant pot of boiling water on a wobbly chair. It's a disaster waiting to happen. In any kitchen, you can make things safer just by using the back burners and turning pot handles inward. A couple other easy wins: lower the temperature on your hot water tap, and just be mindful of loose clothing around open flames. These little adjustments can prevent a world of pain.
So if you remember just one thing from all of this, let it be this. Doing the wrong thing, even if you mean well, can cause real harm. It's knowing the right, evidence-based steps that actually save skin and prevents lasting damage.
This one piece of knowledge, cool water for 20 minutes, is just incredibly powerful. It can be the difference between a minor thing and a permanent scar. So please, share this explainer. You never know when it might help someone you care about in that critical moment. What's one burn prevention step you'll take today?